Hey, Will. So good to have you
Hey,
here.
so grateful to be on your show, Brenda.
I meant to go back and look at our first episode, which I want to say was in 2020 when I started the podcast. Can't remember how I got connected with you. I think it was actually Jenny Wilder. I had her on and she said, "Well, of course you've got Will White scheduled, right?" And I was like, yes, who's Will White?" And since then, obviously, we've talked a lot. We got to see each other actually not too long ago, maybe 6 months ago at a conference.
Yeah, yeah.
And,
And I've had you on my podcast.
and my son has been on your podcast.
Yeah,
Yeah.
yeah.
It's been great. So I think your longevity in the field of mental health care, outdoor behavioral health, all the things is just vital. And I know that you are now doing something kind of new and cool. So I wanted to have you on to talk about that. But first, before we do that, can you just give us a background, or not even a background, but a kind of like a 50,000 foot view of what you have seen, let's call it in the last 10 years, around behavioral health for young folks, mental health care, substance use, because I think you have a really good perspective on the bigger picture than some people do.
Well, thank you for trusting me in answering this question. And at the same time, more recently, I really think I can word it correctly because in the last 10 years, there's been so much change. It's hard to grasp it in so many different avenues. So I have been a practicing licensed mental health professional since 19, I got my graduate degree, social work, clinical social work degree in 86, my license at 89. So since last century, I've been doing this work in all sorts of things. I've worked in hospitals, I've worked in private practice, public schools. I worked in boarding schools for a number of years. I helped start a now referred to wilderness therapy hybrid program called Summit Achievement in 96, and I ran that for almost 27 years. And now I do much more consulting and helping with other programs and leaders. So I think the last 5 years has been the most rapid shifts. As you reflected in your conversation with Patricia Ruggles recently, there's been a big shift in the wilderness therapy field. And it went from like 20 adolescent programs to five in almost like a 2 year period.
Yeah.
And so a lot of times when something like that happens, you say, well, it's one thing and they had some negative press and that's why it was. But like anything, it was more than one thing. There was COVID. There was increasing wages because when COVID happened and people started to going to work was riskier, you had to pay people more. So profit margins got less. Behavioral health care, people saw how using Zoom and other communication devices that they didn't necessarily have, we couldn't go to offices for therapy. So people went online. And so everybody started rethinking different ways to provide behavioral health care. And recently, I think it was in November, December, Thomas Friedman, who writes for the New York Times, he referred to this era as the Polythene, that where a lot of traditional things, models are breaking apart.
Mm.
And we can see that. We can say that climate change is one aspect. We can see that AI is another aspect. We can see that functioning governments is another aspect. We can see that there's much more expression of needs for mental health treatment 20 years ago or 10 years ago or even 5 years ago. Very few people wouldn't express it. Now it's really out there. And so there's good and bads with these changes. What's happening in behavioral health care is, and I was one who would judge years ago. It's like, oh, coaching, that's not good. And now I have my own coach, right? Because I see the value of it. And one, we very much, as people in the behavioral health industrial complex, which I've been part of for many years, of course, you only want licensed people because I'm a licensed clinician. So I want only licensed clinicians to provide healthcare. But as I moved on in my career and accessed and used coaching for myself, I'm seeing the value of it and I promote it. So it's really trying to find what works best for you or for your family. And Trish Ruggles' episode on your podcast, she really talks about the need for the right young person going to wilderness therapy. That's a certain percentage of people, or adults. Actually, there's more and more, actually, baby boomers who are going to the outdoors for treatment. Sometimes it's through licensed professionals, sometimes it's coaching. All of that is a big change from a decade ago, and everything was accelerated in the last 5 years.
Yeah, isn't that interesting that some of these things that we traditionally think of for like adolescents or young adults, that people in their 40s and 50s are saying, well, I want to go to wilderness therapy. Like I would rather do that than sit in a, office park in the middle of my city and sit in a pleather chair and talk to somebody for an hour. That sounds pretty good. So yeah, I love that. And I'll link to the episode that you're referring to with Trish, who is a therapeutic consultant who helps families figure out that right mix of what is the right thing for us. So yeah, I agree. I think there's been a significant shift, a lot of pluses to it because, and I know you've seen this, there's a lot of kids, unlike mine, who was a hooligan and like out there wrecking havoc in the world. There's a lot of the isolation, the kids who won't leave their room, won't leave the house, and to have something for them and to have them be able to connect with somebody on a screen, even if that's just an entree to something else, is just hugely valuable. I've talked to so many parents that say, oh my God, thank goodness for, online therapy, because that was the only way we could start to make some change and get out there a little bit.
Yeah, that's another example of the polyscene, right? So we now have computers in our pockets, and now we can connect with anything and information in our pocket 24/7. And it's rewiring our brains, and it's rewired the young people I started working with in my career many years ago are quite different than the young people of today. And I speak from that personally and professionally because I had sons a little bit later in life, and their high school experience was quite different than mine. Some for the much more positive, and some were like for the negative. And we have to recognize that a non-duality, like there's good and bad in everything. And I choose to look at the hope in life and the positive changes in life and how to keep ourselves healthy, mind, body, and spirit. And I think there's just more options. And that said, sometimes going back to educational consultants like Patricia Ruggles and others, is like sometimes there's too many choices and we need guidance. And AI isn't to the place I thought it was going to be there sooner to help people find programs and whatnot and resources. I think it's really important to connect personally with people and have parts of the community. Like the Hope Room community is amazing because people can talk and share their personal experiences. And that is something we need more of because communities, part of the negative about being online and all that is it creates kind of pseudo communities, but real communities face to face, there's much more health benefits.
Yeah, it is so crucial. And, I told you I just got back from a week of vacation with 5 couples. So there were 10 of us, pretty much 99% unplugged for 8 days. And it was amazing. Like, oh, here we are having meals together and talking, and nobody is glued to their phone. And I think you're right with the changes. And I would love to, if you want to just dig a little deeper into what some of those changes are that you're seeing in young people from, let's say, you had a young person at Summit 20 years ago, 15 years ago, and now you have somebody that you're working with, maybe at the trade, which we're going to get into. What are you seeing as those differences from somebody who generally wasn't, a digital nomad to somebody who now is, and we know that we have a hard time like actually disengaging that device from their hands. But what do you see just sort of anecdotally?
Well, in the past, in my early years of my career, whether I was working in group homes in Boulder, Colorado, for called the Halcyon School, and that was a program specifically run by Boulder Mental Health and the Boulder District, and then working at boarding schools, and then starting Summit. Much more in those days, in the 90s, early 2000s, much more of an externalizer, much more expressing themselves, or like their anger, their frustration, even their depression. It was an externalizing type of person. And they often would be using drugs, some sort of drug, not always, but primarily they were expressing their dissatisfaction with their life, or maybe it was their way they were expressing their depression or anger or reflecting what was going on in the family system. I mean, it's hard to generalize, but to put it simply, much more externalizer, much more expressive, much more likely to break things or just, I don't want to be here, I'm walking away. And you referred to your son.
Yeah.
He was more of that era, right? That era. And we can see that actually in the numbers. So as much as we know there's a very serious drug problem in America today and in the country, the actual numbers of the usage is down overall.
Right.
To today, we see much more. So in those days, diagnostically, I'm not a big DSM 3 or 4 or 5, whatever it is now, but it's always, you had to do it because we had to do it because that's how you can get insurance. And the bottom line is you diagnosed pretty regularly this oppositional defiant disorder.
Right.
They weren't listening to their parents. They weren't doing what they're told. They were telling teachers to kiss off and blah, blah, blah. And it's like in Fast Time in Ridgemont Highs, which very much dates me, but I'm just telling you, right? It's just like, yeah, I'm just ordering a pizza, just like, and that would be seen as oppositional and defiant. And now it's much more of an anxiety, much more internalized, or not having as good of emotional intelligence to express what's really going on for them. So there's theories of why that is, and there's facts. We know one of the factually, and that was part of the lawsuit that just went against social media, thankfully, that they were found guilty of creating addictive algorithms for young people that would help exacerbate mental health conditions.
Right.
And spending time, well, correlation does not mean causality, but the research is showing causality, that there is the higher usage of social media and screens, the higher likelihood of suicidality. I mean, that's Jonathan Haidt's book.
Yeah.
So that's one piece of it. COVID was another piece of it. Another piece of it is parents' consumption of huge amounts of news. I am one of them. I'm much better at that than I had been in the past, but it's a time where there's a lot of anxiety. So the number of young people being diagnosed with anxiety is much higher.
Right.
And yet, spending time in the wilderness or being outdoors or doing things will actually lower anxiety. But it's counterintuitive to a parent, and I am a parent, you are a parent, with an anxious child to push them to do something.
Right.
And yet, they need encouragement. They need to be pushed. They need to be told, you can do this and you need to do this. So that is what we're seeing. And I helped out at a program called Mountain Valley Treatment Program Center, which is in Plainfield, New Hampshire, for a couple of years, doing some clinical supervision. Young residents there, a lot of them had became so overwhelmed with anxiety that they were no longer leaving their homes. And that parents would over accommodate and trying to be a caring parent, and at the same time it would backfire because it would get worse and worse.
Yeah.
So we see more of that. And the drug use, I mean, the thing about drugs today, we can't really keep our finger on what's going on because there's so many variations. The marijuana is so high toxicity or whatever. Yeah. The amount of THC in marijuana is so high. And then there's all the other drugs that are easily accessible because it's mainstream.
Yeah.
So although there is that, the percentage who are using drugs in adolescence is much lower. And so some of what the treatment models that is about more and more talk therapy. And I've always been more into experiential therapy. And I came to that through, I worked in the area where I am in northern New Hampshire. After I was in Colorado, I moved back east to northern New Hampshire, and I started working in a mental health center with adolescents and a high school with adolescents. And I really didn't feel like I was making real impact. I spent a year traveling around the world, doing a lot of climbing and backpacking. I studied in a Buddhist monastery for a while, just living, you know, how backpackers life. I was in my 30s then. It was during the Clinton administration, and they said they were going to have universal health care. So I like, wow, I'm going to come back and they'll figure out health care. I'll come back and open my private practice. Well, that didn't happen. But I learned a lot in a year. And a friend of mine had been a headmaster at a boarding school. And he said, hey, we would like you to come to this boarding school, be a counselor, and help run our outdoor program. And I'm like, that's great because I don't have a job and I'm still trying to figure out what I'm doing. And so I started working at this boarding school. I'm like, oh, and this was before the era of therapeutic boarding schools. So it was a traditional boarding school. And I realized the work I could do living in dorms and being a counselor and running outdoor programs much more effective than an outpatient work.
Yeah.
And I helped start an outdoor program called Prep for Success, and it was taking young people who had finished wilderness programs, and they would transition. They would do a 10-day trip with me and some other faculty in August, and they would enter the school if they could do the 10-day trip, and then they would meet with us every other week for a group meeting. And that's how I got in, like, first exposed. This was in 93, 92 or 3, to wilderness and adventure therapy. And I saw the power of, like, oh, this is really powerful. And yet, a lot of the young people who had been to wilderness at that time, they weren't ready for school yet, right? They weren't ready to sit in the classroom. Some were undiagnosed learning disabilities. Many were undiagnosed. Some had been newly sober, that was during the 28-day model. And they just weren't ready. They needed a safer environment. And so that's how, when I was approached by a couple people to start Summit Achievement, that's how that started. And Summit was a hybrid because I was like, these wilderness programs are great, but they don't get them ready for school. So at Summit, they go to school Monday, Tuesday, Wednesday, and then they would go out on expedition Thursday, Friday, Saturday, Sunday. So, and that's still running today. But it was that transition piece. And working and living with young people, that's like, this is very powerful. And I know I was much more effective because at a boarding school, not only did I run Prep for Success, but I had to run the outdoor program because you never have just one job at a boarding school. You have to have two or three.
Yes, of course.
And I ran outdoor programming. And because of that, I knew I was much more therapeutically, quote unquote, therapeutically, even though I wasn't doing therapy. I was much more effective in helping young people in the outdoor program than I ever was in sitting in office.
So
Well, maybe
interesting.
sometimes in the office. But you know what I'm
Yeah.
saying? It's like, and I've taught in different colleges around this area for years. And one of the questions I ask to my class and also in workshops, who most impacted you during your adolescent years who wasn't a family member? I've asked 1,000 people this. I never had one say my therapist, but I've had many say a coach, a scout leader or spiritual leader or English teacher or drummer.
Yeah.
So it's really about the people who they're around. And a lot of that is the experiences they're having. So Kurt Hahn, one of the founders or the founder of Outward Bound, he didn't like therapists sitting in an office either. And I believe he coined the term, I could be incorrect, but experiential therapy. So working alongside, doing things with people to help create change. So that's part of how I got involved with the trade, which is a really cool young adult program, more like a gap year experience, because we're helping people get exposed and learning about the trades. There's a lot of tradespeople mentoring, and we have a lodge where what we refer to as apprentices live there. And they're not doing a lot of individual therapy, but they're being mentored 40 hours a week in a job in which they get paid for. So it's the idea of experiences, connecting community. And these are old ideas, right? People in wilderness therapy, it didn't have therapists in it until the late 90s.
Yeah.
I was one of the earliest licensed therapists in programs. I remember one time a program lead in another program came to me and she said, "You therapists are ruining wilderness therapy." I was like, okay.
Okay.
Well, no, I mean, maybe we did. I don't know. But, the point being, it's like changes happen. And I mean, for many years, wilderness therapy was run by educators who felt that therapy, they weren't as effective. And now you see people doing wilderness therapy or outdoor therapy, licensed clinicians, not doing just hour-long sessions. They're doing long retreats with families. Yeah. So all of it goes back to the Polyscene. All these things are starting to change because we're also identifying where people are so different, and we can't just say, like in the early days of wilderness therapy, well, it's a black box model. Everybody comes in, doesn't matter their diagnosis, they'll do 28 days and they'll be great afterwards. And that wasn't the case, right?
Right.
And so individualizing the models and really trying to meet people where they were at. So that's a long answer to the question how things have changed. Another thing that I've in this conversation, or maybe it's just me talking, is I don't see young people are not as mature. There's a lot more immaturity of young people today. And I don't mean it in a negative way. I mean it is they have, I think parents, and I being one of them, we're probably too overprotective of the real world and definitely underprotective of the online world.
Yeah.
And so people are very anxious about all outdoor programming, Outward Bound, National Outdoor Leadership Schools. It's hard for them to enroll anything longer than like week-long programs because people are afraid of something bad is going to happen to them.
I'm so glad that you connected back to the anxiety of the parents because, as we see more and more horrific things happening around us, and we get to see not just what's happening in our community, in our neighborhood, in our city or state, but what's happening all around the world, of course, that's going to make you fearful for, oh, wait, so I'm just going to send my 11-year-old off for 4 weeks to a summer camp? Like, what? That seems crazy.
Yeah.
So, of course, that's going to trickle down, and they're feeling that. So, I think that was a really good introduction into what I would love to just dive into the trade and what you're doing and what the sort of genesis for that was as we're seeing all these changes in the availability and like the different formats of quote unquote treatment, which I use that term very loosely because obviously there's different degrees of that. But tell us a little bit about the trade and where did the idea come from and what do you guys do there?
Yeah. Well, the trade is we opened our doors in the summer, last summer, so 2025, and it is a not for profit company or organization, not for profit. And the website is tradeforlife.org. We are part of a larger not for profit called Musalak Visions. So that organization has been around for almost over 40 years. And Musalak Visions runs a lot of different programs in the new Northeast area, and they're expanding beyond the Northeast. But they have always believed in health and wellness and in behavioral health care. And so they have provided services not only to state funded people, but also to private pay. And they actually started Mountain Valley Treatment Center, and they are Mooselock Visions. Also, Summit Achievement is part of Mooselock Visions now. So that's how I got connected with them a number of years ago. And I've known the family who started that in the 60s is when it started. So it's going to be over. Before they created Moose Visions, it was called the Pike School in Pike, New Hampshire. So Pike, New Hampshire is not too far from where I live. They have a large, like 2,000-acre mountain, which has mountain biking and backcountry skiing. And adjacent to that, they have an inn, a boutique inn that has cabins for rent and for people to have an outdoors experience, but very nice outdoors experience. And they also, this is where Mountain Valley originally was. And right near there is a school called the Oliverian School. And so the trade is actually a program for young adults of all genders, 18 to 30 plus, who are interested in learning about the trades, not just one trade, but all different trades. They're going to get exposed to a lot of different trades. It is not a primary treatment program, but a number of what we refer to as our clients or apprentices, because they become employees, have been to primary treatment before. So they may have been in substance abuse program or a mental health program, dual diagnosis, and they don't need necessarily more talk therapy, but they want more experiences. They want to work. They want to learn how to live independently in a world that is rapidly changing. So back to the poly scene, we're the traditional path of going to college, it's not benefiting people as much as it has been in the past, because we know that like a lot of young people are graduating and not getting jobs anymore. And yet we know that there is a dearth in tradespeople and that the value of being a tradesperson is going up.
Oh, yes.
And yes, because you tried to call a plumber this week, or right? So
Yes.
that, and we as a, I respond like that because we see like, yes, this is great work. When I was in high school, possibly when you were in high school, we had shop class
Absolutely.
and they had home ec. And I will say that I grew up, so I went to high school in the 70s. Home ec, we boys didn't go to home ec.
Right.
You know, yeah, it was weird.
Yeah.
And boys went to, we went to
Wood shop.
shop, and the girls went. It was so like looking back.
I know.
But anyways, all of that was taken apart. I think in the 80s and 90s, and there wasn't either of those programs, and the need for tradespeople is actually growing. And with AI coming in and taking a lot of entry-level jobs. So part of Moose Vision, because they're not for profit, they have to use any profits to further their mission. And their mission is like, what are we missing for young people today?
Mm-hmm.
What can we provide for young people that they can learn and help get on with their life? And so part of the modeling of the trade was like, we want people to learn lifelong skills, not unlike wilderness. I mean, when you do a wilderness program, you do learn lifelong skills, how to survive
sure.
or stay found, et cetera, but you're not necessarily using them daily, right? You're not necessarily, we had this whole era where a lot of people who went to wilderness could go back and work in wilderness, but there's less wilderness programs. So that aspect is kind of drying up. And yet a lifelong skill to being able to understand how a car works. How do we change the oil? And how do we cut a grass right? How do we fix a small engine? How do we paint a house? So at the trade, the company itself has full-time tradespeople, always had, because they have different buildings. Because where the Oliverian School is, where Mountain Valley, those are all different buildings that need to be taken care of.
Interesting.
And so we had the tradespeople to begin with, and now they're taking the apprentices on the job with them to show them the different trades they can and expose them to it.
Right.
So it's not every day they're at one thing. They go to a different trade each day. We literally have the company, because they're really supportive of the area, which is rural New Hampshire up north. They bought a auto repair shop, public facing. So, right, we're going to start changing tires, because this time of year we start moving from our snow tires to our regular tires, because we can save a lot more if you have two sets. And so we're, okay, we're doing that today. And every Friday we're all doing this. And they work as a part of a community being exposed to. Now the trade, they're being exposed to different trades. They get some certification, but if they're really, and you don't need certification to become a landscaper.
Right.
You can probably find some certifications.
Right.
But you need to know how to work hard and learn the skills. Mm-hmm. And the interesting thing about this model, which is unique for any young adult program that I know of, they get paid. They are paid in working.
That's
so
huge.
Day one, they're getting paid to do the work. And they're getting paid to work, and they're expected to work 40 hours a week. And within that, I've really become a big fan of occupational therapy. And that was through my experiences at Mountain Valley and watching their executive director there. His name is Zach Shaper. He's a fantastic occupational therapist. And he helped educate me on how the history of occupational therapy and how it is really about helping people to live and live independently, to help assess them on what their needs are, whether they need more social skills or they're good with their social skills but need more executive functioning skills, etc., etc. And you pinpoint and you work on those different things: fine motor skills versus gross motor skills. The point of all of that is for people to learn to become independent and interdependent, because we all need to learn to be independent and make a living because we live in a capitalist society. And yet we're interdependent. We don't want to be fully dependent on our parents, but we're interdependent.
Yeah.
For many years, as our parents get older, they become dependent on us, and we provided, and we were dependent on them. And so learning interdependence, when is it a good time to ask for help? When are you feeling and being enabled? So the model is really about less talk and more doing. So the therapeutic aspect of it is you're doing something, and these tradespeople have incredible skills and incredible stories, and will be the people will say in the future, like, oh, I remember when John, the HVAC guy, was telling me about this. And those are the important lessons that we all need. And wilderness therapy back in the day, it was when you ask people what was the best thing about it, and who impacted you the most. Most of the time, it was one of the field guys.
Yes, the staff. Yeah.
Wasn't that often that would, right? Your son was like, oh, this field guy, he was or she was.
Yeah.
So the trade's really exciting because it's different. It's meeting a need. The organization did a thorough evaluation, talking to a lot of different people, because there's young adult programs, but there's none like this that we're hoping. And right now, I believe we have capacity of 14, and we're like 7 or 8, and we have a number of slots for the summer for young people who are going to graduate high school and really don't know what they want to do, but they're not ready for trade school, and they're not ready for independent living, and they're not ready for college, and yet being at home isn't the best thing for them.
Yeah, it's that weird spot of like, you're in that zone of, and I see so many parents that have kids in this zone of they're not quite ready for anything. So sounds like that's filling a huge gap. And I think you said it's meant to be like a 1-year program. They're with you for about a year.
Yeah. And they're young adults, so we know it could be less because they have agency.
Yeah, they can bolt if they want.
Right. And they have to. We talk everyone. Do you want to come here? Recognizing you're working, you're going to live in a house with other people. We have full-time staff who live in the house with the apprentices to help them with all the different aspects of their lives. So, they're onboarded for a new job that they get health insurance if they want to sign on for. They have a 401(b) matching IRA or retirement account if they so choose. So it's really exposing them to life as it is.
Yeah.
And some of them will probably go on and say, yeah, I learned a lot of different trades. I thought I wanted to be a carpenter, but boy, I learned about the electrical work, and I know I need to get certification. And now I feel confident enough to go to school for it. And now I won't walk into class and people laugh at me because I don't know which end is up on a pair of pliers.
Yes.
Right? Yeah. So they are able to, they have the confidence. And some, we have one who's almost graduating. He's like, man, I learned enough about the trades that I don't want to be in the trades. I'm thinking going back to college and finishing up. But I went to college and wasn't ready for college, but now has the confidence. So back to the idea of confidence in wilderness back in the day. It was like they built confidence by learning bow drill fires. They built confidence by being able to survive in the outdoors. Yes. Also, there's nothing like building confidence, like building something that's
Hmm.
going to stand the painting a room in a house that somebody else might be using, helping pulling down the walls of an old cabin and putting up new ones and going like, wow, that is something somebody's going to enjoy. And I did that work and I got paid for it.
Yes, I was going to say getting a paycheck is, and I imagine for some of the folks that are with you, it could be their first time they've ever received a paycheck. And I think
Every
it's,
one of them. So far, every one.
yeah, so valuable,
Yeah.
so empowering. Like, I did that. First of all, I didn't know how to do it. Then I learned how to do it. I did it, and I got money for it.
Yeah.
That is I think we underestimate, right? Because we're old and we've been doing this life thing for a
Yeah.
long time and we get it. But we forget that for a newly minted 18-year-old or 19-year-old or 20-year-old who's never had those different roles in their life, they don't have that experience. And it feels so good.
It's such a self-esteem builder.
Yes.
I feel like, because I have to be transparent. A lot of the apprentices, their skills when they first get there, like they, like not a joke, that don't know which end of the hammer works or anything. But those are skills that if you scaffold the learning, that if you put everything in place, once you learn those skills, they're lifelong skills. And you
Absolutely.
can walk on a job site and get a job. We know the construction business is continuing to boom in America. We know that, and we know a lot of that segment of the workforce is aging out. And
Yep.
so part of the trade, the whole concept was helping young people who may not go to college to become independent
Yeah.
and maybe work on their own. And a few of our apprentices so far are neurodiverse. And so they're anxious, they're a little timid, they don't have sequencing down as well, not as good at forecasting. But let me tell you, every one of them now is just like they've got it down and
Mm.
they've got the whole sequencing down, which is similar, again, going back to the experiential therapy model, the wilderness idea. It's like once a person learns the system, they become adept at it. It builds self esteem and they know that they can work through challenges.
Yeah. So amazing. I love it. Well, we will make sure and get links in the show notes. What was the URL again? The
The trade for
trade for life.
life.org.
Okay. And we'll have links
Yeah.
in the show notes there if you want to check it out. It's so encouraging to hear about different kinds of programs that are really setting young people up for today's world and the realities of today's world. It's just, it's absolutely crucial. And yeah, I want to get out to New England so I can come see you and see this
Yeah,
amazing
please
program. It
do.
would be amazing.
Well, the world is changing so quickly, but some things aren't going to change for a while.
Yeah.
Like eventually, we'll probably have robot carpenters, but I'm a little. Who knows what'll happen between now and then?
Yeah. My garbage disposal gets clogged up. I need help.
Yeah,
I need help.
yeah.
Love it. Thank you so much, Will, for taking the time. And we will make sure and point people toward all the resources that you mentioned. Anything else you want to leave folks with? If, the parents that are listening are usually exhausted, right? They're
Yeah.
looking for something that is going to help their young person. And I'd love to pull from the vault of your mind and heart any words you'd like to leave them with.
Well, very cliche, but this too shall pass.
Mm.
Like you got to hold on tight, and you get through the storm, and things will get better. They always do, and really making sure you connect with others in a community that's safe and collaborative, and show the love, right? Give a lot of love and be outdoors. Every day I get my outdoor dose for at least an hour, and all of these things. Keep yourself healthy, because it's easy to not be healthy right now between our phones and our earbuds and our TVs and all that. And you know what you need to do. And just one day at a time, keep doing it.
Love it. Thank you so much. I really appreciate having you here.
Thank you, Brenda. I appreciate all that you do at the Hope Stream.
Thanks.